Hello, my name is Eric Arrington. I'm a third-year pharmacy student at UNC, currently on rotation at the Cone Health Family Medicine Center. Today I will be going over the latest pharmacy news for the month of August. For this month's news, we will discuss new guidelines from the European Society of Hypertension, American Society of Anesthesiologists, and the Advisory Committee on Influenza Practices. We will also discuss the recent approval of Zurzuvae for postpartum depression. First, we will discuss the European Society of Hypertension's recently updated guidelines for 2023. The European Society of Hypertension recently updated their guidelines regarding the management of hypertension. Patients with hypertension and coronary artery disease should be started on dual therapy of ACE or ARB with a beta blocker. Triple combination includes a dihydropyridine calcium channel blocker for patients with angina, like amlodipine and nifedipine. In patients without angina, thiazide or thiazide-like diuretics, such as hydrochlorothiazide or chlorthalidone, are also an option. Patients who have resistant hypertension should be managed differently. You can see the classification for resistant hypertension here. In most patients, the first three agents used are ACE, ARB, calcium channel blocker, and a diuretic. If they remain uncontrolled on these, in patients with CKD, the next step depends on their stage. In stages 1 through 3, the first choice is spironolactone or another MRA, like eplerenone. In stage 4 or 5, the preferred next step is chlorthalidone or another thiazide diuretic. That's the difference in management between CKD stages, as the rest of the guidelines are the same for both. In patients without CKD, dual therapy is recommended at the start, except in these special cases listed at the top right of this slide. Dual therapy is typically an ACE or ARB plus a calcium channel blocker or thiazide diuretic. 60% of patients are controlled on this regimen. If the patient does not reach goal on 2 agents, a third agent should be added. 3 agents control 90% of patients. If this does not work, the patient has resistant hypertension. Remember, a beta blocker can be considered at any step when appropriate. As you are likely aware, there are major indications for beta blockers, like acute coronary syndrome, atrial fibrillation, hypertension in pregnancy, heart failure, arrhythmias. These are some of the classic uses of beta blockers in patients with hypertension, shown in the top portion of this slide. The lower portion of this slide are cases where beta blockers may also be considered. The main take-home point from the European Society of Hypertension guidelines is that they recommend dual therapy if the blood pressure is greater than 130/80. And remember to use beta blockers in these special scenarios. Now we will discuss the FDA approval of Zurzuvae, or zuranolone, an oral drug for postpartum depression. This drug follows Zulresso, or brexanolone, which is an infusion used for the same indication approved in 2019. The big change here is that Zurzuvae is taken orally. One major counseling point needed for this medication is the patient needs 400 to 1,000 calorie meal with 25-50% fat for the best absorption. Main thing to highlight is also the quick time to peak concentration. This drug will work quicker than existing therapies such as SSRIs and SNRIs. These two trials use the Hamilton Depression Rating Scale, or HAM-D17 score, as the primary endpoint. HAM-D17 has 17 questions, some scores ranging from 0 to 5, and some question scores ranging from 0 to 2. The total score ranges can be anywhere from 0 to 52. Both trials showed improvement in baseline HAM-D scores after 14 days of treatment with zuranolone. As you can see here, the HAM-D17 score showed an additional 4-point difference in both trials, showing a clinically significant change in depression rating score. These are some things to look for in patients taking this drug. Due to the common side effects of somnolence and sedation, this should be dosed at night, and patients should avoid driving or operating heavy machinery for 12 hours after administration. So, to summarize, this is the first oral medication for postpartum depression. It has a quicker effect than current therapies. An important thing to note is that it can be used adjunctively with current antidepressant medications. Next, we will talk about new data on how to handle GLP-1 medication for patients with an upcoming surgery. The American Society of Anesthesiologists updated their guidelines regarding managing GLP-1 agonists. This new guideline will help to reduce the risk of postoperative regurgitation and pulmonary aspiration during surgery. In patients taking a daily GLP-1, such as Victoza or liraglutide, the dose should be held on the day of the procedure. In patients taking a weekly dose, such as Trulicity, dulaglutide, or Ozempic and Wegovy, semaglutide, the dose should be held a week in advance of the procedure. Finally, we will talk about the new influenza guidelines for 2023-2024 season. The composition of the vaccines changed for this season. The World Health Organization recommended and approved U.S. vaccines to contain hemagglutinin. The big change in guidelines is that patients with an egg allergy no longer need to be vaccinated in special supervised setting. No additional safety measures are needed if they only have an egg allergy. Fluarix and Fluad are the egg-based vaccines Cone will use for this flu season. Fluad is for patients 65 and over. There are different components in the cell culture vaccine versus the egg-based vaccine. Egg-based vaccines use Victoria for H1N1 coverage. Cone will utilize Flucelvax, a cell culture-based vaccine for people with egg allergies. The cell culture vaccine uses Wisconsin component for H1N1 coverage. The component for the other coverages are identical in cell culture versus egg-based vaccines. As you know, anyone 6 or older should get the flu shot. The populations listed here are at a higher risk for complications and should be encouraged to get vaccine with higher urgency than other groups. Generally, it is ideal to get the vaccine in September or October so that coverage runs through the entire flu season. In cases where vaccination is not possible later in the fall, July or August vaccination is recommended. As long as flu season is active, vaccines can be administered beyond October. An important thing to know is that children aged 6 months to 8 years require 2 doses. The doses should be spaced so that there are 4 weeks between doses, and the second dose is received before the end of October. Vaccination has been associated in multiple studies with reduced risk for influenza illness in infants during the first months after birth, when they are too young to receive the influenza vaccine. This is why women who are in their 3rd trimester during July or August should consider being vaccinated. So, to summarize, the quadrivalent components are different in egg-based versus cell culture vaccines. Additional safety measures are no longer needed for patients with an egg allergy. Try to target September or October for administration. There's more information to come on RSV and COVID vaccines. Here is a reminder of what we talked about today. Special thanks to Dr. Pete Koval, Dr. Kendall Heath-Dirks, and Dr. Rachel Shelley for contributions to this month's updates.